Well, after spending so much time on social media and looking at ourselves on Zoom meetings, some people have really become hyper aware of just little imperfections or what they think are imperfections, right?
Yeah, so in the first 6 months of last year, Americans actually spent nearly $9 billion on aesthetic plastic surgery. But there are things to keep in mind before you spring into something to get a refreshment, I guess.
Yes, certified aesthetic nurse specialist Jennifer DeMeo is on a mission to create a culture where people can naturally enhance their features while still looking like themselves, which I think is important.
Right.
Nice to have you with us. Thanks for joining us, Jennifer.
Thank you so much for having me.
So what should people know if they are considering some type of, I guess we call it beauty procedure, whatever that would be?
Sure. I think it's important for all future patients to really research your provider and make sure whoever they're seeing is certified. Go do your research, look online, look at the reviews, their before and afters. It's really important. And how many years they're doing this. I specialize in this in face aesthetic artistry. It's all we do, especially the face.
Okay, so you say that there are a lot of misconceptions out there about beauty enhancements. What do you mean by that?
I feel that a lot of my patients are first-time patients are afraid to do anything because they don't want to look fake. They don't want to look like they have anything done. And you can really look refreshed without looking overdone. This is all about preserving youth and restoring loss.
Well, so are more people, do you see more people coming in for procedures because they're staring at themselves all day on Zoom? Like they're looking, like really, we look at ourselves all day long and then we're taking selfies and pictures and we've kind of created a real culture around that. Do you see more people coming in as a result?
Absolutely. We do see an increase since COVID, since Zoom, where patients are seeing things that they didn't necessarily see before. But it is always important for the provider to kind of gear them towards the right direction so patients don't go overboard and we keep them looking natural and refreshed and good about themselves.
Okay, so you say that you're on a mission to change the narrative around beauty. What is that and why is that important to you?
It's important to me because as a provider and as a specialist in aesthetic medicine, I take pride in really giving my patients a full face assessment and showing them what they need without overdoing it. And I think that's the key. And I think that we have a responsibility as providers to do so. So natural, refreshed look. And, you know, aging is fine. It's inevitable. And we're all beautiful in our own way. And it's not to change you. It's just to make you feel good.
Yeah, so people don't say, like, what did you have done? You look so different.
You don't look like yourself today.
Okay, so what's your #1 secret to looking natural, even if you decide to go with Botox or fillers?
Natural is not to treat just one area. Absolutely integrate skincare. I have that in my practice. It's not one or the other, it's both. And fillers and Botox, they do two different things. And it's important not to say one or the other.
Smart. Right. Well, Jennifer, thank you so much for joining us and sharing your natural beauty tips.
Of course. Thank you so much for having me.